Hello.
Hi, how are you?
I'm good. How are you doing?
Good, good. Thank you for having
Yeah,
me.
of course. Okay, so just a quick intro. My name's Jenna. For anyone who doesn't know, I'm 21 and I'm a junior in college living in Los Angeles. And when I was 18, I was diagnosed with mast cell activation syndrome after I struggled with allergy-like symptoms for basically my whole life. So today we're going to be discussing my journey with food allergies from diagnosis to treatment and also some of the social and mental health aspects that I have gone through. This session was developed by Vindico Medical Education and FAIR, which is the Food Allergy Research and Education, with an educational grant support from Genentech, a member of the Roche Group. The project information and disclosures can be viewed in the comments. I was having trouble putting it in the comments, but I'll be posting this afterwards and it will be in the caption. So this is Dr. Kelly Cleary, Senior Director of Education and Support Programs for FAIR and a mother of a child with food allergies. So how this is going to work is it's going to be a short Q&A session, and there'll also be an opportunity for any of you watching. If you have any questions, comment them and we'll get to those questions afterwards. And like I said, this session is going to be placed on Vindico Medical Education's Instagram and YouTube pages, as well as being posted to my feed afterwards. Okay, so we'll get into the questions. First question for you. So, as you probably know, food allergies can impact people's lives immensely, especially social life and mental health, especially being a young adult, somebody in college or high school. So, what advice would you give to young adults with food allergies?
So this is a question that I actually love to get and to think about because my food allergic son is almost a teen soon. So I'm thinking of ways that I could empower him as he moves on. So the first thing that I would say is I can't escape my mom hat. I would say that even in a time where, if as a young adult you're exploring and things are exciting, you still have to be vigilant and be carrying your epinephrine auto injector if you have a food allergy. And I think that that is the lesson that I really need to impart to my own child. Working at FAIR, I've had the opportunity to meet so many thriving young adults with food allergies who really tell me about the way that they have handled their life as a young adult. Some of them have said to me that this stage of their life with food allergies is sometimes the hardest because it's hard to navigate. It's hard to communicate in a workplace or to new, employers or new colleagues that, this is what you're going through. So I think that really maintaining vigilance, carrying your auto injectors, but using that time to learn to advocate for yourself and communicate really is important. And it's an exciting time for you. So it's, you're navigating that time of exploration plus keeping safe. So that's what makes it tough.
Yeah, that's a great point. I know anxiety is very common with food allergies, and yeah, definitely something I've struggled with. When I was younger, my parents would always order for me at restaurants or communicate my food allergies, and now that's something that I have to deal with, and it definitely is more challenging. And especially in social situations, when you're in college, when you're out and you want to have a social life, it can be difficult to, put yourself in a place where you're basically saying, sometimes I have to be left out of things.
And that's what you hit the nail on the head with, anxiety and how sometimes we are all triggered by transition times, especially with food allergy. So those transition times, whether, you're a parent and it's going into preschool or you're a college student going into college. And I think that that's what's so important to start advocating when you're still, in the protection of your parents. So there are times that we'll go out to dinner, and even though my son is a 12-and-a-half-year-old boy, I make him order his food, explain his food allergies, so that he can become empowered to do that when I'm not, not with him.
Yeah, it is great to do that. And I will say, as a 21-year-old, I do still sometimes ask my parents to order for me.
Well, that's good to hear because I have a 15-year-old and he still asks me to order for him. So that's good to hear.
Sometimes you don't want to do it. It's
Yeah.
fair. So can you describe some of the challenges that people might face on their journey to getting an accurate diagnosis for food allergies?
Well, as I'm sure you probably experienced, because oftentimes with mast cell disorders, it's even harder to get that diagnosis, and you're seeing so many doctors. But even with food allergies, as far as we've come with advancements, it's still not a real elegant process to become diagnosed. So there are many different things that we need to be diagnosed with a food allergy. So when you're being diagnosed with a food allergy, you're going through a skin prick test where small amounts of your allergen are put underneath your skin. You're going through blood tests to look through your antibody screens to see where your IgE levels are. And then it's your clinical history. Did you react, if you're coming in and you say, I have, this reaction to this food. And then the gold standard of all of that diagnosis is an oral food challenge, where you're coming into an office, so a supervised medical visit, and you are being exposed to a food that maybe those other tests did not definitively say that you had an allergy, and then you're coming in to test those foods. So in our scenario, my son probably went through 15 oral food challenges where we would go into a supervised medical visit, and he would be given, starting out with the tiniest bit of a food that we thought he was allergic to, and then building up over 4 hours and then being observed. So that's really the gold standard, but the process is hard, and it's just not an easy, straightforward process. But I'm really hopeful, because there are so many innovations in diagnostics coming up that I think will improve that process.
Yeah, it's interesting you mentioned that too, because I think recently, at least from my perspective, it seems like the discussion around food allergies has expanded, and what's considered an allergy isn't just something that's extremely severe and life threatening in the ways that were more commonly talked about before. And so I know personally for me, it's been sometimes difficult for some of my less severe allergies, because the typical skin pricking tests won't react much because my skin isn't reacting, whereas when I eat the food, I'll react. And so I think it's interesting to see how those things will develop and how testing might develop to cover some of those other circumstances.
And I think you're so right, because, you mentioned that there are so many foods that now can cause a food allergy. And we in the United States think of the top nine. So, we have the top nine food: peanut, tree nut, eggs, milk, shellfish, finfish, sesame, soy, and wheat, right? So those are our top nine. But people can be allergic to anything. And even if the food that they're allergic to is not within the top nine, it can still be an extremely severe food allergy. So I think that it's really important. And that's certainly a misconception that we see, that, but people can be allergic to anything. And diagnosing those is sometimes hard.
Yeah, and also, like peanuts is one of those top nine, which I am quite allergic to, but fish is also one of those top nine, and I'm not allergic to fish. It's one of the few foods I can eat. So it's also interesting to see that too. And some people have different beliefs when they hear that someone's not allergic to one of the most common allergens. They'll think, oh, well, then you must not have allergies. But that's, again, another common misconception. Allergies really aren't the same for everyone.
Absolutely. I know people within the fair community and the food allergy community that are allergic to 6 of the top 9 allergens. But then I know people who are allergic to one severe allergy that's not even within the top 9. So it really runs the gamut. And it just goes back to the point that food allergies are life threatening, and we need to take any food allergy seriously.
Yeah, definitely. So you touched on this a bit, but can you explain some of the new treatment options that are available for food allergies and how they differ from what was previously offered?
So this is an exciting time in food allergy, and I say that as a physician, but really as a mom. I think that, one of the things that, as a parent of a food allergic child, I was always looking for, what could I do more? And up until now, really we relied on avoidance and avoiding our food allergy, and doing that at any cost. And in the past few years, we've been fortunate to have 2 FDA approved treatments for food allergies. So one was approved a few years back. It's a peanut protein powder that's given in it as an oral immunotherapy, so given in small increments, again under medical supervision. It's for kids 4 to 17, and really, it's just changing the threshold for having a severe allergic reaction. You're not eating your allergen, but really can help people from an accidental exposure. And then exciting, in February of 2024, we had a new drug, a biologic, approved by the FDA. And I say a new biologic, but it actually has been around for 20 years. I remember as a resident, omalizumab was used to treat asthma. So it's been around for 20 years. So they know the side effect profile, but now this biologic is here to really be able to, again, increase the reaction threshold to allergens. So, they studied really peanut and a few of the other allergens, and it was, really great results and very promising. And I know that, these innovations are so important to the food allergy community, because for so long there weren't here. So now to have options to talk to your allergists and your doctors about and see if you qualify, that to me is what's really exciting. And we have excitement coming up even in epinephrine delivery modalities, so hoping that is expanded beyond injections, but really an exciting time for food allergy, and I know I am very grateful for the innovation and research.
And that is so exciting. And correct me if I'm wrong, but I believe that second medication, or the medication that you mentioned, was previously used for, but it was only FDA approved for chronic hives. So now the treatment options for it are being expanded, even though it was already an existing medication.
Yes. So it's a biologic that has been available now for 20 years and used in even pediatric populations, but now has a new indication. So it's not a new biologic. It is a biologic that's been around for 20 years with a new indication. So again, exciting. Anything that could give families the hope of having some sort of safeguard to increasing that reaction threshold is important.
Yeah, definitely. Well, thank you so much. We're almost out of time. So for everyone watching, you can follow Dr. Cleary to the next segment. She's going to be chatting with Janice Dorimal. Their discussion will cover food allergy challenges and solutions from the parent and clinician's perspective. And as a reminder, there's going to be a survey for this campaign with a giveaway of 5 $100 Visa gift cards. And I'll put the link to the survey in my story. And tonight's live will also be placed on my Instagram feed and posted to Vindico's Instagram and YouTube pages in case you missed a segment. So thank you so much to everyone who was listening. And if you want to watch it again, if you missed anything, like I said, it will be posted, and you can follow Dr. Cleary to the next segment.
Jenna, thank you for having me. It was great chatting with you.
Yeah.